It's welcome to the Practice Management Study Club. The topic is Rejuvenate Your Hygiene and Restorative Schedules with Fully Engaged Patients. It is being presented by Sandy Balarjan and Rita Baumgardner, and we will begin the webinar shortly. And now it is my pleasure to recognize our panelist, Lisa Wilsoko. She is the Director of Education for the NDX Center here in Palm Beach Gardens, Florida. So please feel free to reach out to her with any questions, comments, or concerns around our educational opportunities, both live and virtual. And we have Joanne Friedman. She is a Territory Sales Manager for Canada. And I get to say, take it away, Joanne.
Thanks, Jessica. It's my pleasure to introduce our speakers today. Sandy Balarjan is a leading authority on how to increase the effectiveness of dental business systems. Sandy is author of 3 books, Dental Office Administration, first and second edition, published by Top Hat Publishers, and the Canadian Dental Office Administrator, published by Nelson Canada. She created the first certificate course in dental practice management at the University of Toronto, Faculty of Dentistry. Sandy has lectured at dental faculties across North America and has had articles published in many journals, including the Journal of the Canadian Dental Association, Oral Health, Spectrum Teamwork, and Just for Canadian Dentists, as well as many other publications. As owner-operator of Dental Office Consulting Services, Sandy specializes in dental practice management, consulting, hiring, coaching, and training dental teams, implementation of in-office programs, dental business, and operational plans. Our co-speaker is Rita Baumgardner, who studied psychology at the York University Bachelor of Arts program before completing her dental hygiene diploma at Medics College in 2008. As an emerging speaker in the dental world, Rita has taken her expertise from the last 16 years, and she's excited to share tips and tricks that can help every practice effectively increase productivity, reduce stress, and maximize revenue. Take it away, ladies.
Thank you. Welcome, everyone. And I'd like to thank NDX once again for this opportunity to be able to speak to you. So tonight we're going to be talking about rejuvenating your hygiene and restorative schedules with fully engaged patients. What you will be learning in this webinar will be things, for example, if your recall system is working effectively and up to date, why then are there openings in your hygiene columns? And we also want to talk about how that would affect your practice value, because if you have openings in the schedule, then that indicates that either you have too many open hours or that possibly your systems aren't working. So the hygiene system, your recall system, is one of the most important things that a potential buyer, for example, would be looking at. So how does your recall system affect the overall practice? We'll be talking about that as well. How much should each hygiene chair be producing per hour? And when I'm talking about that, I'll be talking about booked hour. Turning your hygiene time into productive time as well. So we're going to be going through all of this and, of course, using the right communication skills to personally engage with your patients. Now, the important thing to keep in mind is that dentistry is a relationship, and it's built on trust and communication. And there are various ways of communicating with patients. And, of course, technology has certainly helped in the past few years. So what we're going to be talking about tonight is really integrating technology with your current systems, because dentistry is a relationship business and the human contact is extremely important. So total reliance on the electronic systems can sometimes affect your schedule in a negative way. So we'll talk about that a little bit as well. So essentially, appointment scheduling is an art. So how the appointment schedule is booked affects everyone in your office, as you know, including your patients. And every time you have openings in the schedule, of course, your overhead expenses are increased. Scheduling takes focus and it takes commitment. And one thing that it doesn't take is complacency. It doesn't, if your staff become complacent where they've been used to doing one thing the same way all the time, then it can affect your schedule in a negative way. So success is achieved through effective communication and strategic planning, how you're contacting your patient and how you are communicating with your patient and in what media that you're using is really important. It's more important than ever now to make the link between oral health and systemic wellness, especially in the age of COVID. That's really important to know. So as you know, the #1 time waster in dentistry is short notice cancellations and missed appointments. So when you think about what happens when a patient misses an appointment, the patient loses because they're not receiving the treatment. If they have a diagnosed condition that's present in their mouth, they're not receiving the proper treatment. The doctor loses, of course, because there's no production. And the team loses because it's very, very frustrating when you have the schedule perfectly booked and confirmed, and then it falls apart 5 minutes later. So it's extremely frustrating on everyone's part. And but there are techniques in order to keep the schedule full and productive. I'm often asked how much each hygiene chair should be producing per hour, and that's per booked hour. The industry norm in this area is between $180 to $200 per booked hour. So that's taking into account the hygiene downtime. In your handouts tonight, that you'll be getting after the webinar, I have included what to do with hygiene downtime. So there's a list of some telephone skills included in that, and also I've included a bit of a policy on recalls, how to do recalls, and what communications to say to your patients. So looking at the cost of missed appointments, beginning with, and I fashioned this off of the cost of a hygiene appointment, for example, it being between $180 and $200 per booked hour. So what's the true cost of just 2 cancellations in the hygiene column per day? That the value is $200. So that is $400 with 2 cancellations times 5 days a week. So what that translates into is $2,000 times 4 weeks. That's $8,000 per month. That's $96,000 per year in lost revenue. So that's the true cost. So why do patients cancel in the first place? Because they can. We make it very easy for patients to cancel. We give them instructions at the time of booking the appointment. We tell them how to cancel it. And maybe that's an assumption that we're assuming that they're going to cancel. But the majority of reasons for cancellation are frivolous. It's the patient, or the patient doesn't understand the importance and thinks it can wait. Or another reason that patients cancel is because the patient owes you money. So the accounts receivable and the appointment scheduling techniques go hand in hand. So you can prevent no-shows and short notice cancellations by the way the appointment is scheduled in the first place. So using a proper appointment scheduling techniques is extremely important, and the communications that you say to the patient. Don't ask the patient a question. Guide and direct your patient to a time that suits your schedule. So be assertive with your patients, but don't necessarily be aggressive. But guide and direct them. They expect that. They don't expect you to ask too many questions, and don't ask them, if or when if they would like to schedule the next appointment. One question you can ask them is, do you prefer morning or afternoon? And that's one legitimate question that you can ask when you're scheduling the appointments. So how you make the appointment in the first place will determine whether or not the patient will show up for the appointment. So also by using the different terms like recommended treatment versus prescribed care, I always think of the fact that the patients are coming to see a doctor, and the doctor is reaching a diagnosis. So they're diagnosing a condition. And if you say the treatment that we recommend, I understand the reason that you do that, and which is important. However, if you say that the doctor has prescribed this treatment, your diagnosis is this, you have cavities or whatever, and that the doctor is prescribing the care, then it's a much stronger message, and it really helps the patient understand the value of the treatment. So you can say to the patient, in order to schedule a time that will work for you, will you look at your schedule and tell me a day of the week that you're least likely to be interrupted? So be assertive without being aggressive. And also, if you ask that question, tell me what day of the week you're least likely to be interrupted, that helps to overcome the patients that work shift work, for example, because even if they work shifts, they generally know when their days off are. So when the appointment is made, you can say to the patient, we'll be sending you an email reminder and a text message closer to the appointment time. So be sure to respond to that email and text message by pressing confirm. I just want to mention to you at this point that I've been in offices where they are solely relying on electronic messaging system with their patients. And in every office that I've gone into, the schedule falls apart. Now, so I think a couple of things were happening. They're really good systems, and I think it's very important that you use them together with your effective scheduling techniques. But it's very important to condition the patient so they understand what to expect and how to respond to that text message. I will tell you, I was in an office one time where the lady came in, and I happened to be there working with that office that day, and she said she received 34 emails because she didn't know that she had to press confirm and then they would stop. So it's very important that you condition the patient so they know what to expect, and then when they get that email, they won't ignore it. They'll know that they need to take action on it. So that's an important thing to know. Also ask them, would you like a courtesy reminder call 2 business days in advance? Because some of them certainly will respond to email and text message, but some of them also want the phone call as well. And if they haven't responded to the email and text message and they've missed their appointment, then I would make just a rule of thumb to call them as well. And ask the patient, as you're making the appointment, will you do something for me? If you need to change that appointment for any particular reason, would you please call me at least 2 business days in advance? So that helps to state your policy more or less by telling the patient that we need at least 2 business days notice if you need to change that appointment. And if you have a repeat offender who has done this in the past, then you might want to say to them, add to that statement, this will help you to avoid any unnecessary rescheduling charges. So that indicates that there is a rescheduling charge that they would have to, that you have put in place. So that helps the patient to understand that. So electronic reminder systems, emails and text messages, they are great systems. They save a lot of time if they're used correctly and they're followed up on. Total reliance on electronic communications is dangerous and has caused many well-booked schedules to have numerous openings and missed appointments. And I've seen this firsthand consistently. If there's total reliance on this, on that system, the schedule will definitely fall apart. So somebody still has to be working with this reminder system. Somebody has to be following up with the reminder system and also to be calling the patient. The other thing that you need to know is that it's really easy to delete an email or a text message or the person who may look at it and forget about it. And remember that in the subject line, sometimes the patient will look at the subject line and say, oh yeah, I know I've got that appointment, and then completely forget about it. They'll get distracted. The same with text messages as well. So it's very important that they're followed up with, and that there's follow up and follow through with those appointments. So there are really 2 main reasons that that cause the schedule to fall apart. And one is that the administrative team member relies completely on electronic communication. And as I say, I've seen this happen time and time again. And I realize that confirmation calls, they're tedious and time consuming. So the use of electronic media is really appealing, and and that it's fine, but I would use it as an adjunct. So the problem is that many patients might be receiving a large number of emails in their inboxes and may get overlooked or deleted. And I'll tell you, this time of year, a lot of patients get a lot of junk mail or advertisements. And I know I'm constantly trying to clear out my my email, and I probably have over 1,000 emails sitting in my inbox. For that exact reason, you know, I have to go and unsubscribe, spend a day unsubscribing. The same is true with text messages. You know, they're easy to ignore. They could be getting a lot of text messages, but they're even easier to delete. So those are key things to keep in mind. The other reason that a schedule might fall apart is that the patient wasn't properly advised on what to do when they receive the email or text message. They didn't know, like, for example, that lady that came in had 34 emails that day from the same office. The patient has to be told that they need to press confirm in order to make sure that that is a confirmed appointment. Some things that not to say if a patient is trying to cancel, and I've witnessed this firsthand as well. So you wouldn't say to the patient, oh, you can't cancel that appointment because I don't have time to fill that spot. And this happened in an actual office, and the fellow at the other end of the phone said, well, isn't that your job? And he was right. It is your job to fill that spot. What you don't say also is our policy requires that you provide us with 48 hours notice, or we have to charge a short notice fee. Everything is wrong with that. First of all, you're quoting policy to patients, and patients don't care. Policies are your internal guidelines that guide and direct you, and you guide and direct the patient. And it also says, or we'll have to charge you a short notice fee. It sounds like it's punitive. It's punishing the patient. The other thing is 48 hours notice. I can guarantee that they're going to call you on a Friday if you're not open on a weekend, and they've essentially given you 48 hours notice. So patients don't care about your policy. As I mentioned, they're your procedural guidelines that you are to follow. They guide you, you guide your patient. So however, if it is a valid reason that the patient has to cancel, try to make it difficult for them to cancel, but not make it impossible for them to cancel. And just say to them instead, when would you like to come in? Then say, let me see what I can do to reschedule. And if they have canceled at short notice, they've canceled a prime time appointment, don't give them a prime time appointment the next time. So make it a little bit more difficult, and that helps them to understand the value of the appointment as well. So where do most cancellations occur? Well, usually they occur in the hygiene schedule. And why is that? Because often it's considered to be just a cleaning. Now, if you've got to think like a patient is thinking, well, I brushed my teeth and I flossed the ones I want to keep. So it's, you know, I don't have to spend the $200 on going for a professional appointment today. And the other thing that's wrong with this statement is it's not just a cleaning. If you say the word just, that minimizes the value of everything else you have to say after that. So the patient isn't listening anymore. If you say the word cleaning, that's indicating that a hygienist is just cleaning their teeth. So that basically you're brushing the teeth that they've already brushed. At least that's a perception. So it's all about the words, wording that you use and the verbiage that you use. So really when your patients come to see your dental hygienist, they're coming to have prevention therapy because a dental hygienist is not just a tooth cleaner. If so, do they vacuum? Do they vacuum as well? But anyway, they are registered, regulated healthcare professionals. They are highly trained and specialized therapists. They are disease prevention therapists. They're healers, essentially. They're periodontal therapists. And they promote healing and oral health. Just as a doctor or a surgeon will perform the surgery, a registered nurse will help promote the healing. And by doing proper dressings and dispensing medication and that kind of thing. It's similar in the sense that your dental hygienists are the healers. They help to really promote oral health. So it's really important that you use the right verbiage and believe in the value of your services in order to help your patients understand the value of your services. So what not to say when you are calling a patient or you're sending them an email or a text message. Do not say, I'm just calling to remind you that you're due for your dental cleaning appointment. If you'd like to schedule that, please call me at this number. That's too wishy-washy. You're not giving them a directive, for one thing. And the word just, as I mentioned, minimizes the value of everything else. And when you say the word remind, you're expecting them to forget. So then they can say, oh, gee, I forgot all about it. And you do for your dental cleaning. I've already mentioned why the word cleaning is not a really effective word. It's better to say dental hygiene appointment. I was actually in an office one time where the staff member said, well, they don't understand what a hygiene appointment is. So, which was a bit confusing because I thought they're seeing a dental hygienist, but and they're receiving professional hygiene therapy services. Anyway, so instead, you can use the same messaging that you use in text messaging as you would in if you were talking to them by telephone. So on the first call, I would say, Mrs. Smith, this is Sandy from Dr. Jones' office. You are due for a dental hygiene appointment, and Dr. Jones has asked me to schedule that for you. When you get this message, please call me back at this number. I look forward to hearing from you. So that is assertive. It's not aggressive and it's not pushy. It's just telling her that she's due. And the doctor, why I said Dr. Jones asked me to call you is because that sounds like the doctor has given the recall person a directive to call that patient specifically. So if that's the first step, if there's no response from that one, then the second time that you contact the patient, you'd say, hi, this is Mrs. Smith, this is Sandy again. So address the elephant in the room by saying, I tried to get in touch with you last week. I didn't get a response. But Mrs. Smith, this is Sandy again. I left a message for you last week. Dr. Jones has asked me to call you to schedule your dental hygiene appointment. Could you please call me back as soon as possible? Thank you so much. I look forward to hearing from you. And that would be the second message. Now, I also note in the chart that you have sent the second message to the patient. I usually recommend that you do this about a week apart, not a month apart, because if you do it, if they get too far behind, then your patient is very overdue for their hygiene appointment. And if there's still no response from that, then the third contact from the patient, you would say, hi, Mrs. Smith, this is Sandy from Dr. Jones' office. Dr. Jones asked me to call you. Please call me back as soon as possible at this number. Thanks so much. I look forward to speaking with you. So now you've got the doctor involved. So it sounds much more important. And then the chances are that the patient will call back and schedule that appointment. But in all of these, I'm not giving the patient too many options. I'm telling them that this is what I'm calling for. And this is a courtesy to your patients. It's not pestering patients. That's a really important thing to remember, is that you're not pestering a patient by telling them that you are concerned about their oral health and that you need to schedule their appointment to make sure that they maintain their oral health. So that's the messaging, but use the same messaging either in text messages or emails or by telephone as well. Now, you may be asking, is this the right thing to do? Many dental professionals feel that they have an ethical obligation to offer their patients every treatment option, regardless of their opinion of the patient's willingness to accept the treatment or to afford it. And after all, it's the only fair way of doing it. If a patient has a condition in their mouth, they need to know about it and let them make the decision. Your patients trust you, and they depend on you to offer the best possible treatment and to maintain the doctor-patient relationship in your office. So at this point, I'm going to turn the podium over to Rita and let you take over from here.
Thanks, Sandy. That was wonderful. All right. So yeah, is recall a four-letter word at your practice? Recall traditionally is not a fun job, as you can see this woman here. I know I've done the job before. There's a lot going on, and it's not something that anyone is truly excited about doing. And it should be looked at from a team perspective. I'm a dental hygienist by trade, so I used to be a hygiene coordinator. I've always helped out where I could, because I know from that experience that there's a lot going on at the front desk. Their brains are torn in so many different directions. As Cindy said, you know, you're making sure that you're not getting those cancellations, you're checking patients out. So there's just a lot going on. So it's nice to have a very team perspective when it comes to working recalls. And it's not that the intention isn't there. It's definitely there from the front desk. I mean, everybody wants the same thing. We want to have our patients have good oral health. We want them to come frequently. We want to increase the revenues at the practice. But without a proper game plan or the tools or the analytics there to forecast sort of where our attention needs to be, it's really difficult to execute on that plan. One of the first steps that you can do, and this is again coming straight from the hygienist in the hygiene chair, is pre-appoint. It's, you know, just as Sandy was saying, it's incredibly important to be assertive. When I was a hygienist, I would just say to my patient automatically, while they're sitting in the chair, we're waiting for the dentist to come in, I've gone ahead and I've booked your cleaning 6 months from now. Just so that you don't fall behind on your oral health, you'll get a reminder 2 weeks before. If it doesn't work for you, we can change the appointment right then and there, because as soon as the patient gets to the front desk, they want to pay, they want to get out. So that's the first step to making sure that we're working our recalls, is from pre-appointing when they're in that chair. Sometimes if we look at the stats in general, it's a higher percentage of patients coming out of the restorative chair when they aren't booked for the next appointments, because often that happens. The patient's in your chair, they need a filling, we book that filling, we forget to book the hygiene. So this is, again, a very team perspective. We want to all be having our eyes on there. That is, when the patient is in the room, whether it be in the restorative or hygiene chair, that we're making sure that their next appointment is always booked. Getting that commitment face-to-face is also a lot easier than having to chase them down through a telephone call, through an email, through a reminder system, through a text. So when they're right then and there, it's something that you can do. If that information is missing, so they don't, you notice that on their file, they don't have an email address or a cell phone number, find out how they want to communicate, and then make sure that you have that in place, so that way, if you do have an automated communication tool, at least that's going to help you. It lowers the downstream workload on the admin team, and it's less of a chase down. And then so that the admin team and the practice isn't in this position where they're feeling really overwhelmed with everything that's going on. And the outcome of this overwhelm is that, and I actually took these stats today. We've got 2,500 practices, stats on that, and it's 51% of an active patient base is unscheduled. Out of that 51%, 36% of them could come in tomorrow for cleaning because they're due or late. On average, 15% are canceling right now as well. It's getting a little bit better. With COVID, it was a lot higher. But if we look at this, this is a gold mine that every practice is sitting on, but is having trouble capturing. And it's actually 50% recoverable. So there's good news here. It's just, we need to make sure that our approach is good and that everyone's sort of lending a hand here, because there's a lot of opportunity that's being missed across dental offices across North America. And if we look at why that's important and how a recall system affects the overall value of a practice, well, it's needed for practices to grow. It's also the fastest way to practice growth. We sometimes think that we need to get new patients in the door. We should spend money on marketing, getting our website. But the reality is that we really need to focus on those patients that are in our door, are in our practice already. We want to make sure that we're keeping that back door closed, because it is the bread and the butter of every regular GP practice. Of course, if you're brand new, you're looking at getting new patients in. If you're specialty, different scenario. But for a regular GP practice, it is the bread and the butter. If we look at, again, the stats, 9% of patients are the overall revenue stream from the practice, 9% is coming from your new patients, 80% are coming from your existing patient base, and about 10% of your patients will fall through attrition every single year. So we want to make sure that we have a handle on that recall and that patients are coming in regularly, not only for their oral health, but also just for the overall health of the practice. Again, closing that back door. We've got some stats here as well. It costs $360 on marketing to get a patient to even walk through that door. If they're not coming back, and on average, you're doing a new patient exam, a full raise of x-rays, you're doing a cleaning twice a year, you're losing out on $800. So it actually costs you a lot more to lose that patient that you worked so hard to get into the practice. And I'd like to note here too, that if you're not fighting for it, somebody else will. As you all know, dentistry has become incredibly competitive over the last 10, 15, 20 years. And if we look at Canadian stats here, we've got 600 patients per dentist in the Vancouver area, 900 patients per dentist in the Greater Toronto area. If we look down south of us, we've got 61 dentists working in dentistry per 100,000 population in the US. So again, it's just showing us that if you don't fight for this and close your back door, somebody else has an opportunity to get those patients. So we've looked back at recall and we think about it. I mean, as I've said before, people don't like working it. It is incredibly difficult job to do. Again, finding the time for it, and then you're going through a list. And historically, it's because we didn't have the proper tools, the direction, the coordination to really do it effectively and efficiently. Now with new times, we do have a lot of these communication tools that we can use to help us. And that's sort of where we're going with this as well is, it's great to have those. And it's no wonder that we've gone that direction, but we don't want to be fooled here. Because again, if we look at the stats, the data doesn't lie. It's showing us that people absolutely love it to confirm, to send their COVID pre-screening form out on a cell phone. And it's great. But when it comes to coming back into the chair for an appointment that's not scheduled, it's only about a 10% response rate. And we know this from all of our stats here at Recall Max. And we've done about 30 million messages. So again, we're very well aware of sort of what opportunities are getting missed when you're setting your practice to an autopilot mode. It's actually, you're missing 90% of your opportunity. So going back to how your recall system affects the overall value of your practice, well, we know that we need to be doing a lot more than just relying on an automated communication tool like Sandy had said previously. If we could rely on them solely, you'd have robots at the front desk and we wouldn't need any staff. But as we know, staffing is a huge problem right now as well across the board. So again, we want to have these tools in place so that staff aren't feeling that overwhelmed, they're feeling less stressed out, but we're not relying 100% on it because we do want practices to grow. And if we set ourselves to rely on automated systems solely, and we know that approximately 10% of your patient base is going to fall to attrition every single year, well, your practice isn't actually ever growing. It's standing in complete neutral position. So, and even some offices I know right now, you're booked out 6-7 months out for hygiene, and that is a great position to be in. So growth doesn't necessarily mean that you have to add in more hygiene chairs or more hygiene hours. It can be as simple as ensuring that you have no downtime, that you have a short notice list that you can refer to right away so that if there is a cancellation, you're able to fill it really quickly. That's also great for patients because if I'm due right now and there's nothing available, you can book me 6 months out, but if there's an opportunity to come in sooner, that's ideal for me so I don't fall behind on my oral health. And I know that from right now because I have stains on the bottom of my teeth that are driving me nuts right now. And it is again because I'm 2 months late for my hygiene because there is nowhere to put me. So it's good for the practice, obviously good for the patients as well. So what does work best for recall? That personal human touch, that engagement. And again, going back to these stats, 20 to 30% of patients are going to respond through a personalized phone, personalized text, personalized email. You can even switch up the communication. Auto message, 10%. Snail mail, it's going as quickly as a snail, it's 3% or even automated voice messages. Some systems out there have an automated voice. When I hear an automated message, I'm hanging up right away. I don't have time for that. If you're going to call me, I want a real person on the phone, especially if we look at the demographics. 18 to 50-year-old, likely a texter. Someone that's older in their 70s and they get an automated voice, that's confusing. They want to chat with you. Take that time to make that phone call to those patients. The other aspect that works really well when it comes to recall is spreading your recall love. I know when I did recall way back in the day, I'd print a list and I'd start up at the top of the list. So my A, B's, and C's were getting a lot of love. Then I would switch it up and start from the bottom of the list. And then I'd miss the ones in the middle. So it's great to have a recall management tool out there that allows you to spread that recall love. Organizing patients, the way we look at it is organizing patients from priority standpoint so that you're working your list from hot to cold. Your patients that are due this month going into next month so that they don't fall behind. Then your patients who haven't been in the practice and haven't been into the practice in the last 1 to 6 months, then maybe 7 months to a year, because you have a greater chance of getting somebody who's due now than who hasn't come in 2 years. So again, using a strategy so that you're working your list from hot to cold and you're really spreading that recall love. The other great method is alternating personal contact. So if you do have a communication tool that's in your practice, it's great to alternate with them. So if you have an automated message that's going out every 2 months to remind your patients that they're due, in that off month, personal contact, personalized text. Hey, did you receive that automated message that we sent you? We'd love to get you in. And that you're going to have a 5 to 6 times greater chance of getting that patient through that door that way. The other great thing that works is teamwork. And I've said it before, we all need to help out. We've got one goal in mind, the health of our patients, the health of our practice. We all have to be working together. And traditionally, when we think of recalls, it's under the admin. And yes, it is, but it shouldn't be now, because without recalls, hygienists wouldn't have patients to clean teeth. And so, of course, we want to be a part of that full solution. I actually, when I was a dental hygienist, my schedule was falling apart like crazy. And it was great. I go to the gym, do my workout. But after a couple of months, my paycheck was really taking a cut. And so the office that I worked at, we did a contest and we utilized our downtime. And within a couple of months, I was so full, I didn't even have a lunch anymore. So it's a team perspective that we want to put here. We want our chairs to be full, but not too full. We want to have a time to catch a breath, but the reality is that they aren't always full. Cancellations do happen more now than they ever did before. So when we have our downtime as hygienists, let's work together. Let's work with our colleagues and our friends that are running the show at the front desk. It really does make the dream work out. And in Sandy's handout, she has some tips of what to do with hygiene downtime, don't you, Sandy? Oh, I think you're muted. Oh, you're muted again. There
Okay.
you go.
I'm good. Okay.
Yeah,
Sorry
you're good.
Yes, in the handout, I do have tips for that, and also some communication skills, because what I've found is that sometimes it's not that the hygienists don't want to help out, but sometimes they just aren't used to using the telephones. So there are specific communication skills in there. Plus, I also have a list so you can identify how many calls that they've made if they had an hour of downtime. I usually ask them to the first hour of downtime or thereabouts to restock their operatories, to sharpen their instruments, do what they need to do clinically, help out with any instruments and that. But if there's another additional hour, hopefully not, but if there is, then get on the telephone. And I always tell hygienists, sorry, I didn't mean to take over here, Rita.
Oh my gosh, don't even worry about it. All good.
I always tell hygienists to call your perio patients, call them first, because you are their therapist. And so if you're calling just to check up on them, see how they're doing, see if they have any questions, then they really appreciate that. They like that a lot. So yes, anyway, that was a long answer for a short question.
Oh, it's all good. And you've said it right there. It's hygienists. You have a rapport with your patients that potentially the front desk might not have. Yeah. And they can feel guilty, if they missed an appointment last week, even hopping onto a missed and canceled list if you have one at the practice or going through your schedule and holding them accountable for that missed appointment, trying to get them to reschedule. Because again, the rapport is there, and the importance of having their teeth cleaned. You've built a relationship with them in the chair.
Right.
So avoiding the recall roller coaster. So I hear this all the time. Oh, December is crazy and January is slower. It doesn't need to be slower, and it gets to be slower because we have, schedule is super full, so we're not working on recall, and then it falls apart, so then we are working on recall, and then it's just this up and this down and this roller coaster that so it's great to be consistent, so that way our recall is consistent as well. I know, Sandy, you had something to say to this.
Yeah, I do, because in the offices that I've been in, what I find is that if whoever's working on the recalls, if they generalize their patients, these are some terms that I hear all the time. Well, all the patients are sick, it's that time of year, or the people are away on vacation, or they don't have the money, it's close to Christmas, so what that recall person has done is made the decision on behalf of the patient. So she or he, it's usually a she, but has decided already that, they're not going to come in. Now, to me, that is sheer complacency. And what happens then is, in other words, it's too hard, because you mentioned right in the beginning, Rita, that, calling recalls is a hard job. It's something that nobody really wants to do. But the fact is that, if you stop calling, or you start generalizing and just assuming that, well, nobody's going to come in because it's close to Christmas or whatever, or it's the holidays, or they're going away on vacation, then what happens is then you start to get flat growth. So that is, some financial people refer to it as a plateau, a business plateau. Now, when you're on a business plateau, what happens is that your speed slows down, your growth slows down. At least on a roller coaster, it's up and down. But when you're on a plateau, you can guarantee that you're slowing down. And what usually is at the end of a plateau is a cliff. So the thing is, when you're on a plateau, or if your growth is slowing down, that's when you need to gear up. That's when you need to work harder, and you need to work the phones harder. You need to work the recall system a lot harder, and switch things up. I really like what you said about, in between the regular contacts that they're expecting, call them, or send them a text message and say, did you receive this? Because the more contact you have with the patients, the more it keeps dentistry top of mind, because dentistry, believe it or not, is not top of mind to your patients. It is to you as a dental professional, but it's not to your patients. So the more contact that you have with them, and the more effective your contacts are, then your schedule will fill up and be productive schedule, plus your business will grow. And that's really the key thing. I thought that was an excellent point that you brought up earlier.
Yeah. And you never know. You might be calling somebody over the holidays, and they might have the time free from work and no family functions. So patients might surprise you with their availability as well.
Yeah.
So it's again important not to make those assumptions just in general.
Yeah, exactly. And keep in mind too, one important part of your practice are senior citizens. And a lot of them don't have dental benefits, but you know what? They're willing to pay for prevention. They're willing to come into your office on the, if you normally have downtime between 2 and 3 or something, call a senior. They're going to want to come in, and make sure you've got time to talk and socialize with them a little bit, because that might be their only social contact. But you've got to think, and that's when you said earlier about strategizing about your schedule. Think about all of these ways that you can get somebody in to those odd times that you can't normally fill. Same with shift workers. My husband worked shifts for 35 years, and he always could fill in those appointment times that may be more difficult to fill with other people, because you've got your prime times in the morning and in the evening, but the middle of the day are the tough ones to fill. But think about your seniors and your shift workers.
Absolutely.
Yeah.
So if we look at who doesn't like easier, I look at this image in hand washing, and I definitely don't want to be doing that. I would 100% be putting it in the washing machine, my clothes. So these tools, all these communication tools that are meant to help us, they're definitely going to take a load off of us. And if you don't have a system in place, I would highly recommend to look into one, especially for confirmations. We see that in the stats. works wonderful. To fill out a COVID form, great to have that automated. But again, it's remembering that we're not relying on that 100%. We are using it as a tool that's going to help us. It's going to make our life easier, but it's not the full solution at all. If we look at the full Sunday, you know, we're planning, we're strategizing, we're talking to people, we're using automation if we have a tool in its right place, but we're not relying on automated message because it's simply just part of the package. It's the cherry that's on top of the sundae. Anything else you wanted to add to this at all, Sandy?
No, I think that you, yeah, just maybe to just summarize that, you're absolutely right. It's part of the whole package. So using the automated systems, which I love the automated systems, but using them and excluding the human touch and the personal touch is not the right way to go. You need to have a combination of everything. So the cherry on top certainly makes the sundae, and it's just one added tool. And we're really fortunate. You know, I'm from the age where we had to do it all manually. Everything was manual, including our appointment schedule and our one rate system. And I really dated myself, but that's okay. But now you've got all these great tools that help you and enhance your practice. And if they're used properly, they're fantastic. Yeah.
Absolutely. All right, so that brings us to the end.